Home is where the heart is. That immediately links health and family and place.
Time is right, in our view, to have a vision of how health and housing can work together. We have to build strong partnerships where housing automatically thinks of health.
So for me, the link between healthcare and housing is vast.
Living in a home is absolutely crucial to somebody's well-being.
Being at a conference like this, organisations will naturally talk together. There's going to be interesting conversations about the work that people do, and making those personal connections is really going to be key to wider work to collaborate.
It's important that people recognise the link between poor housing and poor health, because if you don't recognise it, then you don't tackle it sufficiently.
I was really keen that we actually brought people together to talk about health and housing and the opportunities. Generally, we tend to stay in our own little silos, so this is about breaking down those silos.
It's really great for us to think that there's going to be a kind of strategic approach across the whole of an area.
There are layers of opportunity for collaboration between NHS providers, commissioners and the housing sector.
How does East London come together around some things that no one council, no one CCG, no one provider can sort out on their own?
It's really vital that events like this are held to move things forward so that services can start to be commissioned and delivered rather than just talked about.
Idea sharing is the key to learning. It's absolutely brilliant.
It's absolutely vital for organisations to work together and talk about best practice approaches, lessons learned, how we can work together as a partnership going forward.
We all agree that we need to act collaboratively.
Time is of the essence.
What an exciting opportunity it is. One of those rare opportunities where you have a sort of a blank sheet almost to get it right.
We thought it was a great event you've organised. It was really, really useful to everyone in different ways to be in the room together, talking about these issues with, you know, the right people.
We had quite an interesting discussion on mental health.
We're finally breaking down the barriers and starting to talk about what really matters.
So we want this to be a beginning, please.
I will certainly be sharing these ideas, putting it to colleagues to see how we can take this forward with the planning department, if we can implement any of these ideas.
There are a few examples of genuine acts of collaboration that will actually take rhetoric through to action.
So it's all about coming together, talking, sharing information, sharing resources, having shared goals. And I think by doing that and the way the context of this partnership's been set up, I think we've got the opportunity to do it.